Could you touch a bit upon laser and vein graft interventions?
Is helpful in that when we think about vein graft interventions, there's these big bulky plaques that can embolize and you get no reflow and issues like that. And so what we've done is take our laser catheter over the wire, go down, do some laser treatment, and then put your filter wire down or something like that. When you're taking a really tight 95% lesion in a vein graft, it's hard to get your filter to pass. And so if you use your laser catheter, kind of create a channel, ablate some of that plaque, and then you're able to put your filter wire down, do your intervention, and do it much safer.
Okay.
So I think it's a very good use of laser. It's a very safe subgroup to use laser in as well, with a very low risk of complications. So I think it's a good one to really utilize.
It's interesting. What about the use of laser atherectomy and bifurcations?
So another great question. As you know, when we do bifurcations and we need to use atherectomy devices, we can't do it with two wires down. You run the risk of cutting the other wire and things. And so when we have difficult to cross lesions, or we have lesions that are very calcified at a bifurcation, sometimes it's helpful to use the laser, because the laser is not going to cut that wire, right? So you can do both limbs of a bifurcation with laser treatment, and not risk having to lose your wire position or damage your wire or something of that nature.
Finally, I know we've been able to get the new laser atherectomy console. Could you kind of talk a bit about this in comparison to the old console in terms of setup and ease of use and sorts of things?
Yeah, no, it's been really amazing, the new setup that they have. I mean, the old system was probably 3 times the size as the new one. It was very heavy. It took 5 minutes to warm up. So, interventional cardiologists are extremely patient people, and 5 minutes is nothing to us, right? I mean, it was awful. You'd sit there and have to wait. It was terrible. And so now you can roll it in much easier. The console itself doesn't have that warm-up time, so that's much better. It used to require a special outlet to plug it into, which it doesn't anymore. So now, really, you can take your laser catheter, wherever you need to go, to whatever you need to do. It's very easy to do. It's very easy to set up. And the whole system itself is great for, normalizing it or standardizing it and plugging things in. It just works fantastic. It's a huge improvement.
Yeah,
we've noticed our cath lab staff being much more happy, setting that up and things like that.
And finally, why do you think as a fellow it would be advantageous to complete the laser training course?
Well, a lot of the things we've talked about today get covered in a laser course. It gives you some hands-on experience with the modeling systems. You really understand your device, so we'll go over kind of how it works, the science of it, the different settings of it. So you get a lot more information than just, kind of what we've talked about today. Ultimately, interventional cardiology is about knowing your gear and your product. And if you don't know what you're using inside and out, you don't know how to apply it, and you don't know how to get the most out of that stuff. And so I think a course will really help hone those skills for laser, or for any devices that you use in interventional cardiology. I think it'd be incredibly important to take sort of that course and get that experience and that extra training.
Thank you. Dr. Sintek, I recently came across your publication looking at the safety of laser in circulation. Could you kind of touch upon some of the findings of that paper?
Certainly, no, great. So what we ended up doing was looking at safety with laser use. And our cath PCI registry here in this country keeps track of all the PCIs. And as a part of that, they have a data field that's selected for laser. And so essentially what we did over about a 7-year time period is we pulled all those cases that were coded as laser and looked for safety outcomes. And what we found is that over about 20,000 laser cases, that it was very safe. The overall complication rate, so dissection, perforation, cardiac tamponade, was about 4.2% if you combine those up. If you didn't use any atherectomy device, it was about 3%. So it was more, but it wasn't substantially more, from a numbers perspective. What we found is there were certain groupings where it worked very well and was very safe. So this would have been the in-stent restenosis group. It was very safe. It was almost protective against those complications when you compared it to other cases where laser was used. Vein graft interventions, another grouping where it was protective when you looked at other laser cases. So overall, we were very happy with the results, and it showed that this is a great device to use in the cath lab. It's very safe to use, especially if it's used correctly, and it really should be something that we put in our toolbox to treat complicated patients these days.
Very interesting.